You're listening to The Scoop on Ultrasound, where the world of ultrasound imaging comes alive through dynamic conversations. This episode is brought to you by EDM Medical Solutions. Be sure to follow the podcast on your favorite app so that you never miss an episode. Joining us today is Dr. Vladimir Lemaire, a perinatal sonographer whose path bridges global experience and high acuity OB care. He began his career as an obstetrician in Haiti, focusing on high-risk pregnancies, before transitioning to sonography in the US, where he now practices in a teaching hospital setting. Dr. Lemaire is certified in Doppler, with deep expertise in fetal anomaly detection and maternal fetal imaging. He's also expanded access to education by translating ultrasound guidelines into French, supporting francophone clinicians and patients worldwide. In this episode, we explore how experience and context shape the way we practice and teach ultrasound.
Quality supplies make a difference. At EDM Medical Solutions, we support over 2,000 healthcare facilities across the U.S. with high-quality medical products built for real clinical needs. From ultrasound imaging accessories to surgical instruments and everyday disposables, our portfolio spans women's health, men's health, and the operating room. We've spent over 35 years helping practices deliver safe, efficient, and cost-effective patient care, with the personal support only a family-owned company can provide. Explore our full range of solutions today at us.edm-imaging.com.
Today, we're exploring the depth and nuance of maternal fetal imaging and how lived experience across cultures and care systems shapes the way we interpret and teach ultrasound. Our guest today is Dr. Vladimir Lemaire. Dr. Lemaire is a perinatal sonographer who brings a truly global lens to OB-GYN ultrasound. After 8 years practicing as an obstetrician in Haiti with a focus on high-risk pregnancies, he transitioned into sonography in the US, where he now works in a high-acuity teaching hospital setting. He's certified in Doppler ultrasound, trained in general and echocardiography modalities, and deeply experienced in the diagnosis of fetal anomalies and high-risk OB imaging. His work blends technical precision with clinical decision-making, always with a commitment to patient-centered care, education, and continuous improvement. He's also contributed to cross-cultural access in the field by translating guidelines into French, expanding access to global standards for francophone clinicians and patients. It's a real privilege to have him with us today. Thank you for joining us, Dr. Lemaire.
Thank you for having me, Emmanuel.
So let's begin with your journey, because it's not just shaped where you practice, but how you practice, right? You began your career as an obstetrician in Haiti and now specialize in maternal fetal imaging here in the States in a U.S. teaching hospital. So could you tell us, how has that transition influenced your approach to sonography in complex OB care?
So my approach is pretty systematic, I would say. First, I would go through the patient's charts to look up the patient's age, the pregnancy's gestational age, maternal history, family history, etc. So that I have, before even entering the room, I have like a game plan. So, for example, I was scanning a patient that was transferred to us the other day for elevated AFP levels. So what I did, the moment I put the probe down, I glanced at the fetal posterior fossa, fetal spine, and abdominal wall while explaining my rationale to the patient. And after all these planes were cleared, I then proceeded with the actual fetal anatomic survey. And you could feel, just because I was able to explain my thought process to the patient, you could feel the atmosphere change in the room. And the parents were able to enjoy the scan.
That makes sense. So communication must be so key, isn't it? We've had other guests who've talked about that. We had Lachelle Jones, who is an MFM sonographer herself, and she talked about that a lot, about how important it is to communicate. Have you seen that, especially in those high-risk settings, that you have a lot of influence, right, as the clinician, by the way you communicate, in the way that the patient feels?
Correct. If you were to shadow me, for example, you would often see me discussing umbilical artery and Doppler waveforms with my patients, and that are having a growth restricted fetus, for example. And in my experience, this decreases patient anxiety tremendously and allows the patient to ask more targeted questions to the reading physician.
Right, exactly. I mean, the understanding must be so important, right? Because there's so much uncertainty. I mean, we had another guest who was talking about how at the center of patient care is a human. And that human is very worried when they walk into the exam room, especially in a high risk setting. Now, I'd love to hear about how you balance, though, when facilities do not want sonographers to give too much information. What advice would you give to sonographers who find themselves there? Isn't it difficult if you feel like you're being limited, or would you say no, there's a way to kind of get around that without breaking the rules, so to speak?
It is a difficult balance to achieve. If the patient knows that there's something going on with baby, it makes things easier for me. But at the same time, and patients nowadays, they'll ask you like directly, is there anything wrong? Does everything look normal? While you can't say much, but you also can't lie to the patient. So sometimes I'll say, well, there are some unusual findings, and let me finish up with the exam, and the physician will talk to you more about what's going on.
So there's a lot of tact that you have to have, right? In
Yes.
how you measure your words. That makes sense. So that's good advice. So in OB imaging, especially in fetal anatomy, right, the line between normal and something's off can be incredibly subtle. That's what makes it complex, or one of the things that makes it complex. And so standardized protocols, they're critical, right? But they can't always account for that experienced eye, that gut feeling that the MFM sonographer brings to the table. And the risk, particularly with AI driven protocols, some people say, is that we sometimes prioritize checklists over curiosity, especially when you have pressure right on the caseload and hurry, go faster. That's a complaint that sonographers have more often than not. So many guidelines will push towards standardization, but in fetal imaging, since those subtle details can be everything, how do you strike the right balance between protocol and clinical insight? What have you learned over the years?
That's a very good question. First of all, having a standardized approach has two benefits. First is it allows the examination to be reproducible. It also decreases the likelihood of missing an anomaly. But just to answer your question, let me give you two examples. I use color Doppler systematically when I'm performing a detailed or basic anatomy scan. And just because I used color Doppler, I was able to diagnose a case of aberrant right subclavian artery and ARSA, which prompted me to perform a 76811 instead of a 76805. And this was an isolated finding, so therefore considered a normal variant. And second example, um, just by switching bidirectional color Doppler to slow flow, I was able to diagnose another case of ARSA, which prompted the reading physician to counsel the patient on the benefit of having her NIPT drawn. And the results came back as high risk for trisomy 21. So it is important to stick to your guidelines, to your protocol, but an MFM sonographer should be familiar with the different tools his or her machine has, because some tools may be more suitable to diagnose certain anomalies, especially in the first trimester. So a
That
sonographer
makes sense.
MFM sonographer should master the anatomy landmarks, but also the anomaly markers.
That makes sense. I mean, anatomy, of course, is critical in this, isn't it? I mean, it's a topic we talk about a lot on the show, of course, just in the beginning stages of education. it's a big topic, right? But continually it is. Now, for someone who's an MFM sonographer and they're hearing you and they're like, okay, I just moved into this. I want to improve more. What tips would you give them to be able to improve more now? In terms of, I guess, continuing education, are there specific resources that you've found over the years or practices you've implemented for yourself to continually improve that you would recommend to sonographers that find this challenging?
So it's key for a sonographer to educate himself or herself. And it's important to read. It's important to attend webinars or attend ultrasound conferences on a regular basis.
So would you recommend involvement in different societies, for example, like the AIUM, the SGMS?
Absolutely. Absolutely.
Yes. Yeah, there's a lot of benefit to peer collaboration, right? Certainly. That's something that we've heard too, right? Of how mentorship is essential, right? Finding perhaps a sonographer. I've heard a lot of sonographer who has more experience than you, learning from them, having them take you under their wing, and also just participating in these conferences. You learn so much, right? Just stay on top of the research because ultrasound is constantly evolving.
If you are high-level disinfecting your ultrasound transducer, it's likely you're soaking the probe or using an automated HLD device. But there's a better option out there. TriStel Olds can high-level disinfect your transducer in just 2 minutes and costs under $3 per cycle. Sound too good to be true? Request a brochure today and learn why so many practices are switching over to TriStel Olds. Visit us.edm-imaging.com/TriStel. That's TRISTEL. And now, back to the show.
Now, another important topic besides the technical side is career progression within the sonography profession, especially something like MFM. So MFM, it demands advanced skill. A lot of sonographers hit a ceiling when they're trying to grow into the subspecialty for different reasons. Sometimes things like institutional hierarchy and limited access to mentorship can remain a key challenge. Also, the sense of there not being a pathway perhaps to even move into MFM. So, what's one unspoken challenge you think is keeping more sonographers from entering or thriving in MFM settings?
I think it's the workload. Some sonographers have to perform up to 15 scans per day. And just think about the amount of skill that is required to perform these evaluations and the number of times that a sonographer has to repeat these evaluations throughout the day. And we're not even taking into account patient body habitus, patient BMI, fetal position. So to me, that's the biggest hurdle in our field, the workload.
Right. I mean, it's really stressful, right? It takes a toll too on the work-life balance or just the longevity too, or someone being in that role and feeling like they can't keep up with it. What sort of remedies do you think though we can find for that? Is it all on the institutional side, or do you think it's a mix of factors, right?
It's a mix of factors. If you could always reach out if you feel like that's what we usually do in our lab. If you feel like you've done too many anatomy scans, you could always reach out to a colleague to tell them, hey, I've done 3 anatomies back to back. Could you please take this anatomy for me? That's what we do at our hospital. And that has helped a lot.
Right, being able to keep an open door policy. That sounds like, right, that the sonographers feel like they can express, hey, this is too much. I think that what we see sometimes is certain facilities where the demand is high from the administration, but the understanding of what the sonographers are doing and the complexities behind it are low. It really doesn't lead to good outcomes, right, for the clinical staff and for retention of staff, which is, of course, a critical aspect of administering a facility. Now, beyond scanning, you've also worked on making global standards more accessible. We talked about how you've translated guidelines into French to create that bridge, right, between science and access, which is just so important. So, What have you learned about how language shapes who benefits from imaging standards?
So guidelines are important because they allow the healthcare professional to provide the best standard of care to their patients. So I said healthcare professional because in different parts of the world, ultrasounds are performed by general OB-GYNs, nurse midwives. Although most of my textbooks were in English and back in med school, I felt that I was able to absorb the information faster and better when it was written in my native tongue. So, translating guidelines could definitely improve health equity in OB-GYN care globally. However, providing these settings with hands-on training and lectures is equally important, if not more important. Just think about it. At any point in my career, I can log in on a website to read the current guidelines. But the scanning savoir-faire can only be achieved through hands-on training. Does that make sense?
Right. Yes. Yes, that know-how is critical, isn't it?
Yes.
To be able to do that.
So 14 years ago, a group of ISWAG volunteers came to Haiti to train us in OB-GYN ultrasound. And I can tell you that it made a huge impact on how I practice medicines. So translating guidelines is a good thing, but providing people living in these settings with hands-on training and lectures is also important.
Yes, I mean, that just speaks to the broader topic of access, right? Global access to the modality. I mean, we talk about, oh, underserved, under-resourced regions. And one of the barriers isn't just the machines sometimes not being there, it's also the training. And this is something that one of our guests, Dr. Victor Rao, spoke of, is he said, yes, it's the machines is one aspect, right? For point of care ultrasound, for example, and getting them there. But the other aspect is training the clinicians on the field who actually live there to use it, right? So we have to go in tandem, and not just the training, but like you're saying, the guidelines being in the language, the native language of the clinicians who are there, that makes a big difference. So when we're talking about this conversation of global access, I think we can't leave out the factor that it's not just literally the machine and financing the machine. It's also the aspect of training and ensuring that the patient's care standards are there. So it's really great to hear from you, though, how that work has had an impact and continues to have it.
Yes, correct.
Now, let's look ahead. If you could redesign how we train sonographers in MFM from the ground up, knowing that most sonographers really don't begin in MFM specifically, and with the field evolving and AI coming into play, if you could reinvent how MFM sonographer education begins from scratch, what would it look like? What vision do you?
I don't regret going through ultrasound school. I think it made me a better sonographer. But if I could change anything, I would put more emphasis on anatomical landmarks because at the end of the day, fetal imaging is all about pattern recognition and critical thinking. In
Right.
our simulation labs, I would also add like 3D models of the fetal heart. So the ultrasound students, the residents, and the fellows could better understand the spatial relationships between the outflow tracts. I also think that Intellios has done a good job by increasing the amount of images and cines in our fetal echocardiography board.
That's great. No, I mean, really great to hear what your thoughts are and what we can improve because just as the field continues to evolve, I think that education will be key. We know education is key, right? Especially as we address the shortage because there's a shortage, I feel like for every single healthcare, right, profession, but especially within sonography and then with MFM specifically, there's just not enough of MFM sonographers. So they really have to work on the education side and also on creating a pathway where sonographers can see, hey, I could also go on to specialize in MFM.
Yes.
Well, thank you so much, Dr. Lemaire, for joining us today, for just telling us so much about your story, which is inspiring to hear how you went from OB-GYN right into specializing afterwards in MFM.
Thank you for having me.
Thank you for listening to this episode of The Scoop on Ultrasound. Subscribe today to be notified when new episodes are released, and visit our website, us.edm-imaging.com, to learn more about who we are and what we do.